Every single week, patients walk into my office and say the same thing. Dr. Varsakis, I've been waking up dizzy every morning. My family says it's just vertigo, but something doesn't feel right. And here's what I tell them. They are right to question it. Because the truth is, morning dizziness in adults over 60 is one of the most underestimated symptoms in medicine. It can be completely benign, but it can also be your body's first whisper of a cardiovascular or neurological event that, if ignored, becomes a shout. I'm Dr. Alex Varsakis, and today I'm going to give you a clear, medically grounded framework to understand exactly what is happening when you wake up dizzy, and more importantly, what to do about it. By the end of this video, you will know the 5 warning signs that separate simple vertigo from a serious brain warning. You'll know what to do at home, and you'll know exactly when to call your doctor, or call 911. Stay with me. This one could matter. Let's start with definitions, because the word vertigo gets thrown around loosely, even by patients and physicians. True vertigo is not simply feeling lightheaded. Vertigo is the sensation that you or the room around you is spinning, even when you're perfectly still. It often comes with nausea, a feeling of imbalance, and in some cases, involuntary eye movement called nystagmus. The inner ear contains tiny fluid-filled canals that help your brain understand your position in space. When those canals are disrupted by crystals that have shifted out of place, by inflammation, or by infection, you feel vertigo. And in most cases, about 85% of the time, that's exactly what morning dizziness is in people over 60. A benign mechanical problem in your inner ear called BPPV, which I'll explain in detail in a moment. But here is what concerns me as a cardiologist, the other 15% of cases. Those cases aren't inner ear problems. Those cases involve your cardiovascular system, your blood pressure, your heart rhythm, or your brain. And that is what we need to talk about next. Here are the 5 warning signs that tell me, and should tell you, that your morning dizziness is not simple vertigo and needs immediate medical attention. Warning sign number 1. Sudden, severe onset. If your dizziness comes on explosively, not gradually, particularly if you describe it as the worst dizziness of my life, that is a red flag. Strokes and TIAs, transient ischemic attacks, typically present with sudden, severe, dramatic onset. Vertigo tends to build more gradually or be position dependent. Warning sign number 2. Associated neurological symptoms. Pay close attention. If you are dizzy and experiencing any of the following: slurred speech, difficulty swallowing, sudden weakness or numbness on one side of your body, sudden vision changes, or a drooping face, stop watching this video and call 911 now. That is not vertigo. That is a stroke until proven otherwise. Warning sign number 3. New headache with dizziness. A brand new severe headache that arrives alongside your dizziness, particularly one you've never experienced before, is a serious warning. This combination can indicate bleeding in or around the brain. It is not a combination to take an aspirin and sleep off. Warning sign number 4. Loss of consciousness or near fainting. If your morning dizziness has ever caused you to black out, almost pass out, or left you confused and disoriented for minutes, not seconds, that signals a cardiovascular event. Arrhythmias, significant drops in blood pressure, and cardiac syncope all present this way. This needs an EKG, a Holter monitor, and a cardiology evaluation. That's a conversation for my office. Warning sign number 5. Persistent, non-positional dizziness. Classic BPPV dizziness is position dependent. It happens when you roll over in bed, sit up, or tilt your head. If your dizziness is constant, meaning it does not change based on your head position, and has lasted more than 48 hours, that pattern points away from the inner ear and towards something vascular or neurological. Keep those 5 flags in mind. Write them down if you need to. We're going to keep coming back to them. Now let's talk about the most common cause of morning dizziness in adults over 60, benign paroxysmal positional vertigo, or BPPV. Inside your inner ear are tiny calcium carbonate crystals called otoliths, or sometimes called ear rocks. These crystals normally sit in a specific chamber called the utricle. Their job is to help you sense gravity and movement. As we age, and aging is the number one risk factor for BPPV, these crystals can become dislodged and migrate into the semicircular canals, where they absolutely do not belong. When you move your head, rolling over in bed, sitting up, tilting back, those displaced crystals send a false motion signal to your brain. Your brain gets confused, and you feel the room spinning. The episodes are typically brief, lasting less than 60 seconds. They are triggered by position change, and critically, they do not come with the neurological warning signs I just described. BPPV is incredibly common. Approximately 50% of all vertigo cases in older adults are BPPV. And the good news, it is very treatable. Which brings me to the Epley maneuver. Cardiovascular causes. As your cardiologist here on screen, I need to walk you through the cardiovascular causes of morning dizziness, because these are the ones I most often see missed in primary care. Cause 1. Orthostatic hypotension. This is the sudden drop in blood pressure that occurs when you go from lying down to sitting or standing. In younger adults, the body compensates rapidly. But with age, and with common medications like beta blockers, diuretics, and ACE inhibitors, that compensation slows down. The result? Your brain is momentarily underperfused. You feel dizzy, lightheaded, and sometimes see black spots. This is called orthostatic hypotension, and it affects nearly 20% of adults over 65. Cause 2. Cardiac arrhythmias. An irregular heartbeat, particularly atrial fibrillation, which is the most common arrhythmia in adults over 60, can cause episodic dizziness, palpitations, and shortness of breath. Atrial fibrillation can be silent, meaning you don't know you have it, and morning is actually when many patients with undiagnosed AFib report their worst symptoms. If your morning dizziness comes with any fluttering sensation in your chest or irregular heartbeat, please see a cardiologist. Cause 3. Stroke and TA. A TA, transient ischemic attack, is a temporary blockage of blood flow to the brain. It looks and feels like a stroke, but the symptoms resolve within 24 hours. The problem is that a TIA is often called a warning stroke, because 10 to 15% of people who have a TIA will have a full stroke within 90 days. Morning dizziness that comes with any of those 5 red flag symptoms I mentioned is TIA until proven otherwise. Go to the emergency room. Cause 4. Cervicogenic dizziness. The vertebral arteries, which supply blood to the back of the brain, run through the cervical spine in your neck. In older adults with cervical spine degeneration or arthritis, certain neck positions can temporarily compress those arteries and reduce blood flow to the cerebellum. This produces dizziness that is often triggered by looking up or turning the head sharply. It requires imaging to diagnose properly. The Epley maneuver. If your doctor has confirmed you have BPPV, and only if it has been confirmed, the Epley maneuver is a series of head movements designed to guide those displaced crystals back to where they belong. It works approximately 80% of the time, sometimes in a single session. The steps, briefly. You sit on the edge of a bed. You turn your head 45 degrees toward the affected ear. You lie back quickly with your head extended slightly off the edge of the bed. You hold for 30 seconds. Then you rotate your head 90 degrees to the opposite side and hold for 30 seconds. Then you roll your body in the same direction and hold for 30 seconds. Then you slowly sit up. I want to be very clear here. Do not attempt the Epley maneuver without knowing which ear is affected, and without at least one supervised session with a physical therapist or physician. Doing it wrong not only fails to help, it can make things worse. Vestibular physical therapy is also highly effective for BPPV and chronic balance issues in seniors. Ask your doctor for a referral. When to call 911 versus book an appointment. Let me make this crystal clear, because I hear too many stories of people waiting 48 hours when they should have called for help in the first 48 minutes. Call 911 immediately if sudden severe dizziness with facial drooping, arm weakness, or slurred speech. New sudden severe headache that you describe as thunderclap. Loss of consciousness, even briefly. Chest pain or severe shortness of breath accompanies your dizziness. Sudden vision loss in one or both eyes. Schedule an urgent appointment if morning dizziness has been occurring for more than 1 week with no diagnosis, you have new palpitations or irregular heartbeat alongside dizziness, you have fallen or nearly fallen because of dizziness, your dizziness is constant and non-positional, you are on blood pressure medication and suspect orthostatic hypotension. When in doubt, call. Your doctor would always rather you call unnecessarily than not call when it matters. I want to leave you with a simple 3-question self-assessment that I use in clinical practice to quickly sort morning dizziness. You can ask yourself these questions right now. Question 1. Does your dizziness change when you change head position? If yes, it goes away when you stay still and returns when you move. That strongly suggests an inner ear cause like BPPV. If no, if it's constant regardless of position, that raises cardiovascular and neurological concern. Question 2. Are there any other symptoms happening at the same time? If your dizziness travels alone, it's more likely benign. If it brings friends, headache, chest discomfort, numbness, speech changes, visual disturbance, those friends are red flags. Question 3. How long have these episodes been happening? A week or less with a clear trigger? Schedule an appointment soon. More than 2 weeks and no clear answer from your doctor? Push for a full workup, including a cardiac evaluation. Months to years of recurrent episodes with no diagnosis? You deserve answers. Morning dizziness over 60 is never something you should just accept as a normal part of aging. Your body is always trying to tell you something. Today, I've given you the tools to begin understanding what that might be. If you have been experiencing the symptoms we discussed, please see your physician. If this video helped you, or if you know someone over 60 who wakes up dizzy, please share it. That single share might be the most important thing you do today. Subscribe so you don't miss our next video. We cover preventive cardiology, senior heart health, and the conversations I wish every patient had access to. I'm Dr. Alex Varsakis. Take care of your heart. It's the only one you have.